Picture this. It is 6:47 in the morning. Your alarm has not even had the chance to go off yet, and something has already pulled you out of sleep. Not a loud sound, not a sharp pain, not some wild nightmare, just your mouth. It feels like you went to bed with a mouthful of chalk dust and nobody bothered to tell you. Your tongue feels stuck to the roof of your mouth, your lips feel cracked and dry, and for a second you just lie there thinking, seriously, again? If that sounds familiar, I need you to stay with me, because what most people brush off as one of those little getting older annoyances may actually be your body slipping you a very specific warning, and too many people never catch it. Today, I want to walk through that warning with you piece by piece. I'm Dr. Franklin, and if you are new here, this channel is here for one reason, to give adults over 60 the kind of honest, clear, research-based health information that often gets rushed past in a quick doctor's visit. We do not do panic. We do not do cheap scare tactics. What we do is connect the dots between small, everyday symptoms and the bigger health picture underneath them. And today's dots start in your mouth, but they do not stop there. Before we get into it, go ahead and subscribe if you have not already, because next week we are going into something that honestly caught my attention when I was looking over the data. A very specific pair of common supplements that may actually be draining one critical nutrient from your body instead of helping it. That one is worth paying attention to. But right now, let's talk about dry mouth, because there is a lot more going on here than most people realize. First, something many people never hear about, saliva. Saliva is not just spit. Your body makes somewhere between 1 and 1.5 liters of it every day. It coats your teeth like a shield. It helps neutralize the acids that lead to cavities. It starts the digestion process before food even reaches your stomach. It carries antibacterial compounds that help fight infection in your mouth and throat. In many ways, saliva is one of your body's first lines of defense. So when you wake up every morning and that defense system seems to have gone completely offline overnight, that is not something to shrug off as no big deal. Now here is the part that can change how you think about this for good. A major study published in the journal Oral Diseases found that among adults over 65, chronic morning dry mouth, what the medical world calls xerostomia, showed up in nearly half of participants. Nearly half. But buried inside that statistic was something even more important. In more than 80% of those cases, the dry mouth was not the main problem. It was a symptom of something else. In other words, it was the signal, not the fire. Think of it like this. A smoke detector going off is not the emergency itself. It is the warning that something else is happening. Waking up with a dry mouth every morning is your body's smoke detector. And today we are going to look at which fires it may be trying to point you toward. There are 5 main causes I want to walk you through, and I will tell you right now that at least one of them is probably going to hit a little too close to home. Before we jump in, take a second and say hello in the comments. Tell me your name and where you are watching from. I read the comments and I genuinely want to know who I am talking to today. All right, let's start with cause number 1, the medication puzzle. The number 1 reason adults over 60 wake up with dry mouth is one that almost nobody thinks about first. It is not some mysterious disease, and it is not some hidden deficiency. It is the medication sitting in your medicine cabinet right now. And this is where things get interesting, because more than 400 prescription and over-the-counter medications list dry mouth as a documented side effect. That is a huge number. We are talking about blood pressure medications, especially diuretics. We are talking about antihistamines, the allergy pills so many seniors reach for every spring. We are talking about antidepressants, overactive bladder medications, certain pain relievers, and even some over-the-counter sleep aids that look harmless on the surface. Each one of those on its own might cause only mild dryness, but here is the part that gets overlooked constantly. When you combine 3 or more of them, the effect on dry mouth does not just add up, it multiplies. Research published in Gerontology found that the combination of multiple medications compounds the problem significantly. Seniors taking 5 or more daily medications showed nearly twice the rate of significant dry mouth compared to those taking 2 or fewer. And the average American over 65 takes how many daily prescriptions? Usually 4 or 5, plus supplements. That is exactly why this gets missed so often. I once had a patient, let us call him Gerald, a retired postal worker, 71 years old, the kind of man who kept his bills organized down to the penny and his health records just as neatly. He had been fighting severe morning dry mouth for almost 2 years. His dentist had already seen him 3 times because cavities were showing up like they had come out of nowhere. He was trying every mouth rinse on the shelf, and none of it was really helping. When he came in to see me, I asked him to bring every bottle he had at home. We laid everything out on the table, 6 prescriptions, 3 supplements, and 2 over-the-counter products he used regularly. Right away, I could see 4 items that were known to reduce saliva production. Not 1, 4. We worked with his prescribing doctor and adjusted the timing of 2 of those medications, not even the dosage, just when he took them. Within 3 weeks, Gerald told me his morning dry mouth had gone from a 9 out of 10 to a 3 out of 10. No new prescription, no dramatic intervention, just connecting the dots. So here is what I want you to do with this one. Write down every medication and supplement you take, including things like melatonin, ibuprofen, and antihistamines. Bring that list to your next appointment and ask your pharmacist a very direct question. Could the combination of anything on this list be affecting my saliva production? Pharmacists are incredibly knowledgeable about side effects and drug interactions, and that conversation costs you nothing. Now let's move to cause number 2, the silent nighttime thief. I want you to pay close attention here because this one affects tens of millions of Americans, and most people who have it have no idea. I am talking about obstructive sleep apnea. Here is the simple version of what happens. When sleep apnea kicks in, the soft tissue at the back of your throat partially or fully collapses while you are asleep. Your airway gets blocked. Your brain detects the danger, sends out a panic signal, and your body jolts, gasps, or shifts just enough to reopen that airway. Then you fall back asleep. Most people do not remember these moments in the morning. They never realize it happened. But here is the connection to dry mouth that people miss all the time. When your airway gets blocked, your body does what it has to do. It switches to mouth breathing. And mouth breathing all night long dries saliva out far faster than nasal breathing does. You wake up with a mouth that feels like it spent the whole night in front of a fan. But the dry mouth is not even the biggest issue here. Research from the American Heart Association has shown that untreated sleep apnea in adults over 60 raises the risk of stroke, irregular heart rhythms, and cardiovascular events. Another analysis published in the Journal of Clinical Sleep Medicine found that seniors with undiagnosed moderate to severe sleep apnea had noticeably higher rates of cognitive decline over a 5-year follow-up period. So if dry mouth is waking you up every morning and sleep apnea is behind it, that dry mouth is not the story. It is the table of contents. How do you know whether this might be happening to you? Be honest with yourself. Do you snore? Has someone ever told you that you snore loudly or that your breathing sounds odd while you sleep? Do you wake up feeling wiped out even after a full night in bed? Do you get unexplained morning headaches? Do you ever find yourself nodding off in a chair, in a waiting room, or during a quiet afternoon when you really should not be that tired? Any combination of those signs, along with dry mouth in the morning, should absolutely push you toward a conversation with your doctor about a sleep study. And the good news is that sleep studies are much easier now than a lot of people think. Many can be done at home with a small device you wear on your wrist and finger. No hospital stay, no wires everywhere, no overnight clinic. Many Medicare plans cover it fully. It is worth one phone call to find out. And if this is already starting to sound familiar, type 2 in the comments so I know you are following along and getting something out of this. Cause number 3 is the blood sugar connection. And this one matters because it affects people who have a problem with their blood sugar and still do not know it yet. According to the CDC, about 38 million Americans have diabetes right now. And here is the number that should make every adult over 60 pay attention. Nearly 1 in 4 of them has not been diagnosed. That means millions of people are walking around with elevated blood sugar, damaging their bodies, and they do not even have a diagnosis on paper yet. Here is how high blood sugar and dry mouth connect. When blood glucose stays elevated, your kidneys work overtime trying to filter and flush out the extra sugar. To do that, they pull fluid from other tissues in your body. That creates a kind of slow, system-wide dehydration. One of the places where that shows up most clearly is in saliva production. An NIH-backed analysis found that among people with poorly managed type 2 diabetes, ongoing dry mouth was one of the most commonly reported daily symptoms. And in many cases, the dry mouth had been there for a year or more before anyone ever made the diabetes diagnosis. Your mouth was trying to tell you. Nobody connected the dots. I want to be very direct with you here. If your morning dry mouth is happening along with any of these signs, you need to take it seriously. You are urinating more often than usual, especially at night. You feel fatigue that does not improve with rest. Cuts or small wounds are taking longer to heal. Your vision sometimes gets blurry in a way that is new for you. Do not wait around for your next routine physical. Call your doctor this week and ask for a fasting glucose test and an HbA1c. The HbA1c gives a 3-month picture of your blood sugar average. It takes less than 5 minutes to draw. It can catch something your dry mouth has been trying to warn you about for months. Cause number 4 is the dehydration deception, and this one sounds almost too simple at first, which is exactly why so many people underestimate it. Chronic dehydration. Now, before you say, I drink plenty of water, hear me out. Because hydration in adults over 65 does not work the same way it did when you were 40. Here is what changes as we age. The hypothalamus, the part of your brain that helps signal thirst, becomes less sensitive over time. Research on this is consistent and well established. A study published in the Journal of Physiology showed that older adults can become 2% or more fluid depleted by body weight without getting a strong thirst signal. In plain English, your body can be running low on water and not tell you the way it used to. At the same time, your kidneys become less efficient at conserving water as you age. Your skin loses moisture more easily. And if you are taking diuretics for blood pressure, which we already talked about, you are losing even more fluid than someone who is not. So the result is a lot of older adults quietly drifting through the day, a little dehydrated without realizing it. and the clearest sign they may notice is that sticky, dry mouth first thing in the morning. The practical fix here is one of the simplest on this entire list. Do not wait until you feel thirsty. That signal is not as reliable anymore. Build hydration into your day the same way you take medication, by the clock, not by feeling. Aim for at least 6 to 8 glasses of water spread across your waking hours. Set reminders on your phone if you need to. Keep a bottle in the rooms where you spend the most time. And remember, caffeinated drinks and alcohol do not count toward that total. In fact, they can make fluid loss worse. If this is opening your eyes a little, share it with someone over 60 who wakes up with a dry mouth and thinks it is just part of aging. A lot of people do not realize the body's thirst signals can get weaker over time. And a simple like helps this reach more people who need the information before dehydration becomes a bigger problem. Now, cause number 5 is the overlooked autoimmune condition, and this is the one that ends up hiding in plain sight more often than almost anything else I talk about here. If you are a woman over 55, I really want you to pay close attention. Sjögren syndrome, spelled S-J-O-G-R-E-N, is an autoimmune condition where your own immune system starts attacking the glands that produce moisture, specifically the salivary glands and the lacrimal glands, the ones that make tears. Over time, the body gradually loses the ability to keep itself lubricated. The mouth becomes persistently dry. The eyes become dry, gritty, and irritated. Joints may ache. Fatigue can become heavy and out of proportion to what you are actually doing. And here is why this belongs on the list. About 90% of Sjögren's diagnoses happen in women. The average age of diagnosis is in the late 50s to early 60s. And studies published by the Sjögren's Foundation estimate that it takes the average patient between 2.5 years and nearly 5 years from the first symptoms to get the right diagnosis. A big reason is that the symptoms get dismissed as normal aging. Dry mouth? That is just getting older. Dry eyes? Try some drops. Fatigue? Well, nobody feels great all the time after 60. If those phrases sound familiar, and if your morning dry mouth comes with dry, irritated eyes, unexplained joint pain, or fatigue that feels way too heavy for what you have done that day, please bring up Sjögren syndrome by name at your next appointment. A simple blood test can screen for it, and when it is identified, the entire way it is managed changes. Now let us put everything together into a real plan you can actually use starting today. First, do a medication review. List every prescription, every supplement, and every over-the-counter product you use regularly. Do not rely on memory alone. Bring the actual list to your doctor or pharmacist and ask a straight question about how each one may affect saliva production. You may be surprised by what one honest conversation reveals. Second, take an honest look at your sleep. For 1 week, track 3 things every morning: whether your mouth was open or closed when you woke up, whether you feel rested or still exhausted, and whether you notice any headaches or strange grogginess. If you sleep next to someone, ask them to pay attention to loud snoring or pauses in your breathing. If a pattern starts showing up, ask for a sleep study referral. A lot of these can now be done at home and are covered by major insurance plans. Third, do not skip the blood sugar check. If you have not had a fasting glucose test and an HbA1c in the last 12 months, schedule it this week. This becomes even more important if dry mouth is showing up with the other symptoms we talked about. Fourth, change how you hydrate. Aim for 8 glasses of water a day, spread out across the day instead of trying to catch up all at once. Track it for 2 weeks. Your body may respond more quickly than you think. Fifth, get some nighttime relief while you work on the cause. Look for oral rinses or gels with xylitol like Biotene Dry Mouth Oral Rinse or ACT Dry Mouth Rinse. Use them right before bed every night. And avoid mouthwashes that contain alcohol because that will make the dryness worse, not better. Xylitol-based products help in two ways. They moisturize and they help protect your teeth from the bacterial overgrowth that dry mouth can encourage. One important note here. If you are currently taking blood thinners, lithium, or ACE inhibitors, talk to your doctor before making big changes in your daily fluid intake. Hydration can affect how those medications work, and your doctor needs to be aware of that. And one urgent note, if dry mouth is happening along with trouble swallowing, pain, white patches inside your mouth, or unexplained weight loss, do not sit on it and wait for a routine visit. Get checked promptly. Those combinations deserve real evaluation. Here is the main thing I want you to carry with you from all of this. Morning dry mouth is common, but common does not mean normal, and it definitely does not mean harmless. Whether the cause is medications interacting in ways nobody explained to you, a sleep disorder quietly increasing risk to your heart and brain, blood sugar creeping up without loud symptoms, dehydration that your body is no longer signaling well, or an autoimmune condition that has been brushed off as aging, every one of those possibilities can be identified. Every one of them can be addressed. You came in with a symptom, and now you have a map, and I want to hear from you. Drop one word in the comments below. Type sleep if you think nighttime breathing might be the issue. Type meds if you are planning to talk to your doctor or pharmacist about your medications. Type testing if you are going to book a blood sugar test this week. I really do read the comments, and what you share helps shape what we cover next. If this gave you something your last doctor visit did not, please subscribe, because next week we are digging into a warning sign that a very common cholesterol medication may be causing more harm than good in certain adults over 60. It is one of those topics that gets a lot of questions and deserves a real careful look. I'm Dr. Franklin. Take good care of yourself this week. Just being here means you have already taken one important step. And if this helped you, pass it along to someone who needs it. You might help them more than you know.